Good afternoon. As we indicated at 1 o'clock earlier today, this morning we were informed of a new case of Covid-19 with no immediately identifiable links to our managed isolation facilities or our border. I want to provide you with the latest update on that case investigation. I'll ask Dr. Caroline McElnay to give you the latest information we've been able to establish. I will then talk about the actions that we have taken so far, the requests that we have of the people who work and live around the Auckland CBD, and then I'll talk about the next steps before taking your questions. Dr. McElnay.
Thank you, Minister. Kia ora tātou katoa. I'm here to provide an update on the Auckland community case announced by the Director General of Health earlier today. Auckland Regional Public Health Service has this afternoon conducted a detailed interview with the case. We now know that their role at A to Z collection is in a customer-facing role as a shop assistant. I'd like to take a moment to clarify something important here. This person became symptomatic on the 9th of November, was tested on the 10th of November, was asked to isolate and then went to work on the 11th of November. We now know that this case called in sick to work after receiving the advice to isolate, but after a conversation with their manager, went to work and wore a mask. A to Z collection is closed today and is undergoing a deep clean. Whole genome sequencing will also allow us to compare the genome of this case to that of other recent cases that we have sequenced, and that will help determine the source of this latest infection. The swab from the case has been received by ESR and is currently being processed. It will be processed overnight with a result due tomorrow. We have successfully sequenced over 1,000 genomes to date, and this includes 169 from MIQ facilities. We are aware of media reports around a fire alarm at the managed isolation facility at the Grand Millennium that saw returnees on the street near today's case's accommodation. The fire alarm was 8 o'clock on Monday, the 9th of November. This is not likely to be a source of infection for this case because she was already symptomatic earlier that day. In terms of contacts of today's case, we have identified 3 close contacts and they are all being followed up, isolated and tested. Close contacts include a colleague of the case and 2 friends. They all report being well. The 2 friends are being transferred to the Auckland quarantine facility as a precaution. One of the friends lives alone in the Vincent residences, the same place as the case. All residents of the Vincent residences have been asked to go home and stay home while testing takes place. Health authorities are working closely with the body corporate, and a cleaning company is going in today to do a deep clean of the common areas of the apartment building, including stairwells, lifts and the lobby. All common areas in the apartment building will be closed. A mobile testing station will be on site tonight for residents in those residences. Today's case also took a number of Ubers to work. The drivers are being contacted by Auckland Regional Public Health. Although the Uber trips were very short, because they were in close confinement, we are asking those drivers to get a test and isolate. Following interviews with today's case, we are in the process of confirming a number of locations of interest that the person visited whilst possibly infectious. These include on Saturday, the 7th of November, from 3:50 p.m. to 6 p.m. at Smith & Cooey's department store on Queen Street. From 6 p.m. to 8:30 p.m., the Red Pig restaurant on Kitchener Street. On Sunday, the 8th of November, from 11:30 a.m. to 11:45 a.m., takeaways from Starbucks on Queen Street and from Sunnytown Restaurant, Lorne Street. On the same day, from 6:40 p.m. to 6:50 p.m., takeaways from the Gatto House, 332 Queen Street. On Monday, the 9th of November, 11:31 to 11:40 a.m., takeaways from Starbucks Queen Street and from Sunnytown Restaurant, Lorne Street. Anyone who was dining at the Red Pig restaurant on Saturday night will need to be tested and go into self-isolation until they receive a negative test result. Anyone at Smith & Cooey's, Starbucks, Sunnytown and the Gatto House at these times should watch for symptoms and get tested if they feel unwell, staying in self-isolation until they receive a negative test. This afternoon, around 2 p.m, we have issued push notifications through NZ COVID Tracer for A to Z collection and the Vincent residences. NZ COVID Tracer app users who scanned into either location during the relevant time frames will receive a contact alert advising them to isolate and call Healthline to arrange a test. It's too early to report the number of app users who will have received contact alerts, as the console we use for app analytics is not configured for real-time reporting. Anyone who was at these places around these times should isolate, get tested, and stay isolated until they receive a negative result. Pop-up testing is available today in Auckland, including at the Ellen Melville Centre on Freiburg Place and a testing site at Victoria Park Community Testing Centre. There is also pop-up testing available tomorrow at Key Park Health Centre, 68 Beach Road, and at the Wynyard Quarter Car Park Community Testing Centre on Madden Street. A full list of testing sites in Auckland is available on the Auckland Regional Public Health Service website. Anyone in the Auckland area, and indeed anywhere throughout New Zealand, who has cold or flu symptoms should get a test and stay at home until they have a negative test result. Out of an abundance of caution, we are asking people who work in downtown Auckland to work from home tomorrow where possible. If you must go into this area, please use masks and social distancing while health authorities continue to work to trace the source of this infection. Thank you.
Thank you, Dr. McElnay. We've already moved rapidly while we investigate the source of the current infection. Everyone in the apartment where the case lives is in isolation for the next 3 days, and Auckland Regional Public Health is going to be testing everybody overnight. All of the communal spaces in that building have been closed. The CCTV footage of the fire event is being reviewed for safety. The store in question did not open today. Overnight, the genome is being sequenced, and we will have more information on that tomorrow, and we will do another media update here in the theatrette once we have that information. As you will have identified, at this point, a likely source of infection has not been identified with any certainty. While those investigations continue, we have set out some strong guidance on what we want people in that vicinity to do. So we are asking staff who work in the Auckland CBD to work from home wherever possible tomorrow. Those who can't, please use masks, and of course redouble your efforts around social distancing and around hygiene. Anyone using public transport in Auckland or flying in and out of Auckland should be using a mask. People in the apartment block should remain at home, and they should get tested. As Dr. McElnay has said, a mobile testing unit's being set up tonight, and the apartments will be cleaned. As always, we're asking everybody to observe social distancing, continue to wash their hands, and of course to use the COVID Tracer app so that we can alert you if you are in any way in a more risky situation. Tomorrow we will have more information, and when we have that, we will make further decisions based upon that. That will include consideration of any further adjustments to our alert levels. I do understand that when these cases pop up, they can cause considerable anxiety. But we have a plan. We're currently rolling out that plan. We have shown in the past that it works and that we can stop the virus as we've done before. As we've been saying for the past few weeks, COVID-19 is raging around the rest of the world, and it will continue to be an increased threat here for some time. New Zealand remains in a very strong position. The steps that we need to take are simple, but everybody needs to play their part. If we all do the right thing, then we can get on top of this quicker. So please follow the instructions that we've set out, get tested if you're feeling unwell, and wear a mask to protect yourself and others. We know what we need to do, we have a plan, and we've successfully gotten on top of these community cases before. With everyone doing their part, we can do that again.
Why do you have enough confidence to stay at alert level 1 for the time being?
Look, when we made the last decision to escalate alert levels, it was based on a different set of information. At that point, we already had evidence that there was transmission within the community. We already had, amongst a number of likely cases. We didn't, at that point, have the level of cases that we're dealing with at the moment. So it was a different set of circumstances. Now, of course, we will know more tomorrow. We are simply saying that we won't make any decisions around alert levels until tomorrow, but we are asking people to take those enhanced precautions of working from home, wearing masks, observing social distancing, so that we can get that bit of extra time that we need to get more information and make more informed decisions.
Can you explain why this doesn't meet the threshold for having to adjust the levels?
At the moment, the information that we have suggests that this could still be quite contained, and that we could still well, in the next 12 hours or slightly longer than that, find a likely source of infection, be able to do a genomic sequence link to an existing case, and whilst we're still assembling that information, we're putting some enhanced protections in place in the meantime, but we're not saying that we wouldn't make a decision around alert levels. We're just saying we don't have the information to make that at this point.
Are you frustrated that it's taken, I guess, yes, only 12 hours, but we need to work quickly, don't we, in these situations? Are you frustrated you don't have that information?
I think we've seen the system moving very quickly, in fact. There are a lot of moving parts here. Now, I think what you'll see from the timeline investigations that have been set out, a lot of detail has been gone into here already, and that work will continue, bearing in mind that we, as we've said before, we rely on people's memories when we're doing this process, and not everyone can remember absolutely every person that they've interacted with over the course of a fortnight. It's one of the reasons why we stress time and time again that keeping good records is really important for contact tracing purposes. But the genomic sequencing takes as long as it takes. Now, I've been informed by ESR that they are absolutely aware of the imperative of getting us these results as soon as they possibly can, and they will do that. They'll work as hard as they can to get us that result as quickly as they can.
What's your message to the manager who told their staffer, even after they've been told to isolate, to come in with a mask? And managers everywhere.
Look, our advice to everybody is if you're feeling unwell, please stay at home and stay safe. And of course, our advice to employers is please be good employers and respect that when staff ring in sick, you should go out of your way to make sure that they can stay home and stay safe and protect others at the same time.
Are you angry at the fact that that happened, that this person had the right advice to stay at home, and then they talked to their manager and obviously felt some kind of pressure to go in?
Look, it's a disappointing situation. I'm not going to get into that today, but what I would say is, my request to all employers up and down the country is please be good employers. When your staff ring in sick, please, do everything you can to accommodate that and to allow them to do the right thing by staying home.
Dr. Bloomfield said earlier today that that person would have only been told to isolate if they were in that sort of high-risk category because that's the advice these days. So were they told to isolate because they were considered high risk?
My understanding is that they were told to isolate while they waited for their test result, and that would have been based on the risk assessment that was done by the people who did the test.
Do you know, Caroline, why she would have been told to isolate?
She was symptomatic when she had the test, and that's standard advice that if you are symptomatic, you should isolate. There's a higher level of isolation for those who are in a high index of suspicion, but certainly the key message is if you are symptomatic and you've had a test, you should not go to work until you've got the results of the test.
You went back and made sure that the health practitioner or the testing station that they used, that information was definitely passed on to that person?
That's the information that we've received from Auckland Regional Public Health. They've gone into some detail with that, yes.
You've only put in, we requested limitations in the central CBD. Do you have any information that the woman or her identified close contacts had any movements outside of the CBD at this time?
No, there's no history at all of at this stage of moving outside of the CBD.
Are you afraid at all or nervous at all about what happened in Melbourne where they asked for restrictions in a closed area, but it was already beyond that area, and then they paid the price for that.
Look, at this point, we have the information that we've put out there that we're giving to you, and we will have more information tomorrow that will allow us to more adequately assess any risk of there being wider spread. I'm comfortable that the overall guidance that we're putting out today is the best guidance that we can give with the information that we've got, which is minimising movements in the CBD, is at this point the best precautionary measure we can take.
Essentially saying that based on what you know, even though we don't know the source, on the best information you have, we don't think there is spread outside the CBD, potentially.
Look, we haven't got any evidence to suggest that there's an enhanced risk outside of the CBD at this point. Now, these investigations, of course, are very, very thorough. And if there is, then we will know more about that in the next 24 hours.
So the University of Auckland are holding in-person exams still, like 100-person exams inside rooms, including tomorrow right now. Would your advice be to be, as the Minister of Education as well, to extend those or not do those?
Look, I'm conscious that we are in exam season, both for tertiary education providers and, of course, next week for schools. We start getting into the exam season. Exams are socially distanced exercises. Generally, people are kept well apart from one another. We will review that tomorrow if we need to, based on the information we have. At this point, if we were, my advice to NZQA is that they should continue to prepare for the exams, as the school exams to happen as normal. For the tertiary institutions who are also doing exams, they should make assessments based on how distant people are. Having sat plenty of exams of my own time, I can tell you that the spacing around people generally will be a significant factor in reducing risk of transmission in any of those settings.
So for you, for a student that has, say, an exam tomorrow, your message is go?
Until you hear otherwise, until we put out any further guidance that would suggest that there would be a risk. Now, bearing in mind that this person, whilst a student, has not been on campus attending classes for some time, well before the likely period in question.
How many contacts?
I'll ask Dr. McElnay to comment on that.
I didn't hear the questions.
What about her close contacts? Were they in university settings?
Her close contacts, we've already identified the contacts of her close contacts, and it's a small circle. I'm not aware that her friends were in the education setting. We've got a very limited number of contacts from those contacts.
The woman lived next door to a managed isolation facility and worked near another. Is it possible and is it likely that she picked up the infection from one of those facilities, whether that be staff, or we've seen the infection come from an elevator lift button and, I don't know, maybe touched a rubbish bin nearby? Is it possible that that's where she got it from?
So that's all speculation at this point, but obviously that's what the investigation process looks at. The more information that we gather, the more information, the more linkages we're likely to be able to piece together.
Have there been people at those two isolation facilities, I think it's the Grand Millennium and the Crown Plaza, have we had people at those facilities test positive for COVID-19 and then been moved to the jet park, or has there been no COVID-19 at those facilities at all?
My understanding is that the facility next door to the apartments, there have been, I think, in question, around 4 cases recently. They have been transferred to the jet park as soon as they've tested positive. The other facilities, I'm not sure of.
Yes, I'm not sure about that, but we do have the whole genome sequencing for those cases previously, and so that's one of the critical reasons for us to get the whole genome sequence on this case, is hopefully then to be able to make that connection through the genome sequencing.
Recently, were the people at the managed isolation facility next door to her apartment tested positive?
Sorry, I haven't got the dates for that. It's within the last few weeks, but we can certainly get you a breakdown of those dates. As Dr. McElnay's pointed out, though, the issue around the whole genome sequencing means that once we get that, we will be able to identify whether there's a clear match with any recent positive cases in our managed isolation facilities. And now, of course, if there is, that's a very big piece of the puzzle that will certainly help our decisions on the next steps from here.
Can I ask, when is the next update that you'll give people on alert levels or update and all? And should Aucklanders tonight be doing the mental work preparing to go to lockdown, worst case scenario?
Look, I think we will be in a position by tomorrow afternoon to provide a further update. At this point, our guidance is, please minimise your movements in and out of the CBD, as we've said before. Do those precautionary measures like wearing a mask. Of course, our advice is always be prepared for different scenarios around COVID-19. Every New Zealander, I think, is well accustomed with that drill now, and we'll have further to say on that tomorrow.
Are you investigating a link between case A and this case? Case A went to Metsi Bar, which I understand is only a few metres from A to Z collection. Is there a possible link there?
I mean, look, we investigate the linkages between any new case and any existing cases, particularly ones that are currently active, which we're dealing with at the moment. I'm aware that there have been some suggestions around, potential use of a common toilet and so on. Those are being investigated. None of those have stacked up at this point to suggest that there's a link there. But of course, the investigation's ongoing. That continues.
We've spoken to a Vincent Residences tenant who went to a Victoria Park pop-up to be tested and were told that because they didn't have a GP, they couldn't be tested and they had to go elsewhere. Is that appropriate? Or is that... No,
anybody presenting for testing should be offered a test. That's unequivocal. If someone is at risk, feels the need that that they're in a situation where they should be getting a test, then they should be offered a test. But I'll ask.
No one should be turned away from testing.
Ministry of Health staff to the Vincent apartment block to let them know what is going on, or have you been relying on the media to communicate your message?
Auckland Regional Public Health are following that up, so they have been in direct communication with the corporate body corporate.
Are there some measures in place to ensure that you knock on every door and make sure that everyone in the block knows what's going on?
There are measures to get that information out, and there's a testing site being stood up for the residents. So Auckland Regional Public Health will look at the information that needs to go to the residents, so they're aware of the message that we're delivering, which is to stay in the residence and get tested.
Given the large number of people probably in that building, will there be any sort of enforcement of the isolation there, people station?
Look, obviously we're asking people to do the right thing here. We're asking people to stay home, to stay isolated. Of course, we're going to be looking at what we need to do over the next period of time to make sure that we're doing everything that we can to stop any potential spread. And again, we'll have more to say on that tomorrow. But at this point, the testing is the most important piece of the puzzle, and that's about to get underway. That will be done tonight.
Dr. McInerney, are you satisfied that this positive result was returned quickly enough from Tuesday to today?
Yes, I am. We got the results early this morning.
Are you happy with that timeline? That was quick enough, that positive result?
Obviously, as the speedier we get a result, the better. But this is certainly what we're seeing with the results. My understanding is that the test was actually taken quite late on the Tuesday night, so the usual processing. That's about what we're seeing. So, but obviously, the rapid testing is always best.
Joe.
Do you know how many or how few people actually QR scanned or diarised those locations that have been mentioned that are sort of hotspots? And given the slow uptake that there has been with QR scanning, and there's been a lot of harping on about doing it better, I guess is there a positive out of this that maybe it will scare people into realising they need to do it more?
Look, I certainly hope that people will start doing more QR code scanning. I haven't got the breakdown of the number of QR code scans in and out of that particular location, but I can say that those people will have been notified now of if they fit the time frame in question. This is one of the reasons we ask people to use the QR codes. It means that we can get notification to them very quickly, and then they can isolate and they can get tested. So, my message to everyone is you never know when this might pop up. And so please keep scanning. Please keep using the QR codes. We do know that usage has dropped off significantly as people have felt that, the risk profile of the whole country was lower. But the reality is this could be anywhere around the country at any time that we could be dealing with a situation. So therefore, the QR code keeps everybody safe. It's a really important preventative measure that everybody can be following.
As part of the problem that a lot of these situations that do pop up are Auckland based, and so everyone else around the country has just tuned out because they see it as an Auckland problem.
Look, I guess, yes, I can understand why people might think that, but, there is risk elsewhere around the country as well. So the message is we're a very mobile population. New Zealanders, one of the things that I've discovered is just how many New Zealanders move frequently around the country every day. We are a very, very mobile people. And therefore, you cannot assume, no one can assume, that because we're seeing the bulk of the cases that we're dealing with in Auckland, that doesn't mean that somehow there couldn't be a need to contact trace in other parts of the country at very short notice.
Why aren't masks mandatory on planes then?
Look, again, after every one of these things, we have a look at whether we should change our overall settings for different alert levels. We will have another look at masks, but our guidance at the moment around masks is if you're in Auckland, if you're flying in and out of Auckland, please use them.
What exactly is downtown Auckland and how many people are you asking to work from home?
Look, we're talking about the Auckland CBD. I haven't drawn a particular line on a map. I'll invite people to exercise their judgment around that, bearing in mind that at this point it's not a hard and fast rule. We're saying work from home if you can, and if you can't, then please do things like observing social distancing, good hand hygiene, wearing a mask, wear as much as possible. We are not being, very prescriptive and definitive here because we need more information before we get to that point.
Should the children of people that live in the Auckland CBD be going to school?
Yes, at the moment, my guidance as the Minister of Education is yes, it's still safe to send your children to school. And if should, for any reason that change, we will let you know as soon as possible.
Should people who live in the CBD stay at home, or should they still feel free to go about their business while keeping socially distant?
I think the message to people in the CBD is minimising your contacts, minimising your movements, wearing a mask, maintaining good hygiene. If you're living in the CBD, then please do those things as well.
Do you have any update on the number of contacts in the person's workplace and the number of contacts in the Vincent residence?
At this point, my understanding is the workplace contacts is a relatively small number. Obviously, there's quite a few people who live in that apartment building, and there's a process that we will need to go through there. The first step of which is testing all of those people as quickly as we can, and that testing will get underway tonight. But it is a reasonably big apartment complex with quite a few people in it, and so obviously the quicker that we get on to that, the better, and that's why we're not messing around there. The testing station will be there tonight.
You have quite detailed timings and locations quite quickly about where this woman visited in the Auckland CBD. Had she been using the COVID Trace app, or how did you get those timings?
The information has predominantly come from the case history with her, with the interviews. Several interviews have been held with her today.
Right, so was she using the COVID Trace app? You've got quite specific timings of when she was at specific restaurants.
I don't have the details of how often she used it, but with those specific details, it'll be a combination of the app and also her own recall.
What's your plan for the next 24 hours, Minister, in terms of are you planning to brief Cabinet? Are you keeping the Prime Minister updated in person? What's planned?
So I've had several conversations with the Prime Minister, as you would imagine, to keep her up to date with everything that I know. And whether Cabinet meets tomorrow, if we do, it will almost certainly be digital because Cabinet members are all up and down the country at the moment. If we do meet tomorrow, it'll be digital, and we would do that if we needed to. And then if there was any change to alert levels, of course, the Prime Minister would then convey any decisions that Cabinet was to take. If there are more operational updates in the meantime, then I will do those.
Has she flown back to Wellington to meet with you in person?
Yes, the Prime Minister is in Wellington.
People are not scanning in. People are not wearing masks on public transport. Why do we have to wait for a border breach and possible community spread for you to take a look at it and take a look at mandating it?
Look, as always, we review everything after every potential case. We base our decisions based on what we think the overall risk assessment is at the time, and what we think the additional measures will do in terms of adding extra layers of protection. We do consider compliance and the likelihood of the public following, the guidance that we're putting out when we make those decisions. And so all of this is always a reminder that regardless of what the rules are, everybody should be doing their bit and being careful and taking precautionary steps wherever they feel that that's appropriate. And
Even that people won't listen regardless of if there's not a rule, people won't listen. They don't listen when you ask them nicely to scan. Labor Day weekend, you have signs up and down the country, and people scan. You get 1 million scans on one day, and then straight back down again. Is something going to change?
Look, I think what we have seen from New Zealanders is a lot of goodwill towards our COVID-19 response, and that's why we have been able to achieve what we've been able to achieve as a country. And I do want to see us continue with that level of goodwill from New Zealanders. We haven't been as directive as other countries have been, and yet we've seen a greater degree of compliance than other countries around the world have seen. You will see examples around the world of where governments have issued quite strict rules that people have not followed. We've not been in that position in New Zealand in the sense that when we have issued reasonably strict rules, people have tended to follow them. And I think one of the reasons for that is that they know we only do that when we really, really need to. But that doesn't mean that New Zealanders should be complacent in the periods between times. Everybody can continue to play their part in keeping everybody else safe.
When you send out a push notification, what sort of time frame are you looking at there, the catchment? So this person signs into, an infectious person signs in, do you go 1 hour before and after that time? So how do you know that you're casting the net wide enough to get everyone?
Look, I think it probably partly depends on what the venue is, and the nature of the venue. But I'll ask Dr. McElnay to comment on that again.
Well, we use. Once we have confirmed that the infectious case was there at the period when they were infectious, and we have that verbal information, then we're able through the COVID app to do that push notification, and it's not actually, we're not looking at necessarily the scans, we're actually relying a lot on the information that the person has given, and then there's an estimate of the time that would be a reasonable length of time based on what the person has said that they were there.
Okay.
Someone who scanned in at Little Penang at noon, having the case scanned in at 1:15, and they didn't get a push notification. They had left before 1:15, but they thought that was quite an assumption. It would have been pretty easy to stay 15 minutes longer for lunch. Is that good enough?
Look, happy to get into that and give you more guidance, more specificity around, when the push notification window is. We'll get back to you on that. I'm aware of the time frame, so we'll wrap this up very shortly. I'll take 2 more questions and then we will wrap it up. We will be back, of course, tomorrow, one way or the other, with further information and further updates. So I'll take a question down the front and then one further up the back.
People overseas might see it as pretty extreme to shut down, the heart of a city over one case. Is it a proportionate response, and is, I guess, there a zero tolerance for any cases in New Zealand?
I think it reflects the fact that we're asking people to work from home if they can. It reflects the fact that we're in a very fortunate position around, compared to other countries around the world, and that we're not dealing with community transmission cases on a regular basis in the way other countries are. And that whilst there are economic consequences to the types of decisions that we have taken today, the economic consequences of being in a position where we're facing more draconian measures because of more widespread transmission would be much worse than that. So I think every New Zealander wants to see us do what we can do in order to keep the privileged position that we have at the moment. And I know that there's goodwill from Kiwis to do their part to make sure that we don't end up like those other countries who end up with rolling lockdowns and so on. Last
Minister,
question.
bearing in mind both what you know and what you don't know at the moment, as Health Minister, how are you feeling about the situation?
Well, as Minister for COVID-19, of course, I'm vigilant and always looking at where we can do better. Always looking for more information. At this point, there is there are some information gaps, some big information gaps that will obviously help us a lot when we get that. And I'm hoping that we will get that, overnight or certainly tomorrow morning. The genomic sequencing will certainly help us a lot. And that's an approach that's come a long way since we first started dealing with COVID-19, and it is a very, very useful tool for us in the toolbox.
Will officials still travel to Cook Islands on Saturday in light of the situation to assess the travel bubble?
At this point, I haven't seen anything that would suggest that may change, but of course we've got 24 hours to go between now and then.
Introduce genomic testing in Auckland.
There are facilities there in Auckland. If we need to do them in Auckland, that's one of the questions that I have at the moment. My understanding is that they've been flown to Wellington in order to do that, but we'll be looking at whether or not it would speed things up by doing them in Auckland. We'll certainly be looking at that.
How many people were at the lunch date at Little Penang on Friday?
Dr. Nekonator.
Yes, they're in the party. I think there were 4 people at the lunch where the cases were. There were actually 4 in, I think it was 4 in that party, but I'll just check on the number. And two cases now from that lunch party, yes.
Okay, so we'll be back tomorrow. Thanks, everybody.